So you go and you learn the methodology behind the silent meditation, where the whole point of it is to basically move energy from one part of your body to the other and not attached to it. So you're just aware of your body and you're aware of the sensations and you move it, and it's all done in a very, very spiritual, it's very, very spiritual, and it's really beautiful.
Yeah.
But I did that, and after like a few days I was very, very aware of like how easily I could move sensations up and down my body. And I actually did it whilst I was in treatment, so I was very ill, and I was having to differentiate the difference between my illness and like pain that I was feeling, and then attaching a story to that versus, well, you're just feeling a sensation that's trying to move. And that's kind of where I got a lot of inspiration for my method, which is like a much more physical version of that. Because instead of just trying to get people to become aware by thinking about it and observing, we're getting people to touch themselves. So because you're getting people to touch themselves,
Tap on the head.
we squeeze and
Yeah,
we do it from the feet, literally every single part of your body. So we basically go from the feet all the way up to the shoulders, down the arms, down to the bottom of the back, up to the top of the back, and then back to your collarbone, and then up to your head, and do the head and neck. So every single part of the body is touched. So you become so aware of your own body that becomes your anchor. So even if you've got PTSD, the whole point of PTSD is that you can't process something that's happened, and it completely disconnects you from your body in the present moment, because you're constantly living in that loop, and that's what triggers are. So my whole concept is like, well, your body's always present. It's always present. The mind is not. So if you start to build a relationship with your body and start to realize that it's here, and you will feel pain, you'll get upset, you might cry. That's fine. That's the point.
Yeah.
You've got to literally move through all of that stuff. And then what you then do is rewire your relationship, obviously from a neuroplasticity perspective, about what safety feels like. So what also ends up happening is that people come and then they end up like teaching it to their kids. Kids are like sponges. So as soon as that child starts to feel dysregulated or upset or whatever, you just see them just tapping and moving. And it's like, I've one of my students now, she started coming for herself. She's training to be a therapist, but her 5 or 6 year old, I think, has been coming with her for the last like year or so now. Who's got like really bad anxiety, and it's completely transformed her as a child.
That's interesting, because I know with autism, there's a thing about tapping.
Yeah.
When they're feeling stressed, they tap a body part.
And
to
stim.
It's to stimulate the whatever's going on, and it's to make them anchored and more in control.
Exactly.
But okay, I got a question for you, right? If you're anchoring using tapping, do you not?
Well, it's just not even it's touch.
Touch, yeah. But if you're touching or tapping or whatever it is, so like, sorry, touching even. But if you're touching, do you not feel like that people become so desensitized to themselves because of the world around them, because of the stress?
Yeah.
That they have to physically feel that they're still.
Yeah. That's exactly what it is. That's the whole point of it. But because you're doing it to music, so I've done a lot of different types of therapies and trauma therapies and everything. There's one thing that's across the board in all of them, which is if you start to feel triggered during a session, they will bring you back into the present moment by using your senses. So there's an exercise where it's like, look at 5 things you can see, 4 things you can touch, 3 things you can taste or whatever. And that's across the board in any kind of like trauma work. So what they're doing is they're activating the sensory system. So your nervous system, the peripheral nervous system, is a sensory system, because that's going to then feed into what's actually going on. It's going to give you your perspective of your reality. So I've basically kind of understood that concept and taken it into like a much more fun way to do that, because you're doing it. We don't do all the senses. We don't need to do that. What we do is literally have touch as the main sense, because most people have no concept of being able to even touch their own body, and then don't realize how numb they are until they do it. And then also the sound. So the sound and the rhythm of the music. And then because you're constantly moving and rocking to the music anyway, that's what do we do with babies? We rock them. It's a soothing thing. Yeah. So you're self-soothing because you're constantly moving. And then on top of that, you're then touching your body to the music. And suddenly people just start to feel this like complete calm. And that's the point, is it
Yeah.
desensitizes all of those like external triggers. The nervous system
Yeah.
calms down. It comes and releases that stress cycle,
Yeah.
so that you're just not in that space where you're just like, high alert, everything's trying to kill me. And that's a huge thing within MCAS. Your body thinks everything's trying to kill you.
Yeah, it's an autoimmune
Yeah,
response.
so it's a response.
Your immune system is trying.
Everything's trying to attack you. Yeah. I'm not even exaggerating. When mine was at the height of how bad it was, and the reason that I got it in the first place, because I didn't start off with that. That wasn't like a starting point for me. That was like during. I don't even know how many different treatment protocols I've been on at that point. It was probably like 2 and a bit years into like me having to be on like mad serious different types of treatment that just kept making me worse and sicker, because I think the whole time I was so traumatized, and I'll tell you why I was so traumatized. But like, yeah, there was like, I just couldn't take anymore. My body and my system couldn't take anymore. So I became allergic to the world. I was allergic to, the air.
Yep,
I was
common.
allergic to all cleaning products,
Yeah.
even just like vinegar.
Yeah,
all foods. At one point I could eat 10 foods.
Yeah, that's common.
I'd get like the migraines. I couldn't get up. I would get like serious swelling in my face. So everything would swell up and I looked like a hamster. I just wasn't able to function in any way, shape or form. I used to faint quite a lot as well.
Did you get like the over like beating heart and stuff?
All of that.
Yeah, the tachycardia. So that's like
Yeah.
they've now diagnosed it as POTS.
Yeah.
Which is like now it's like an over. I get a bit worried when it comes to MCAS, because there is like a fear at the moment now where people have an over diagnosis, if you know what I mean. They want a diagnosis for everything, and that's the scary bit.
Yes.
They're not talking from a place of trauma.
There you go.
They're talking from a place of like, oh, I've healed. If you're talking from a place of trauma still, and you want to, I'm like, no, I'm not interested. Because you're not an image of what we want. Because we said before, like, we cut customers out. Like, if we know that you're not on that healing journey, we don't want you to be part of that, because why do you want that kind of energy around you, if you know what I mean, as well?
Yeah,
it's like
very draining.
Yeah. It's draining. Girl, it is
It's
very
very
draining.
draining,
Yeah. It's exhausting, because you're just like, you're trying to help them, but why should you try and help them if they can't even help themselves?
No, but this is the problem, unfortunately, where people have been failed by the system, by the healthcare system. So then when they meet somebody that might have some sort of answer, it's this like literal attachment. It's like, well, you're going to cure me. And it's like, it doesn't really work like that. And that's not the education that people are given, especially when they move into the more like holistic, like alternative, or just anything that's not Western medicine. Because essentially Western medicine, you go to a doctor, the doctor diagnoses you, and then the doctor goes, this is what we're going to do. And you go, okay, that's it. That's the conversation. If you go to a doctor and then they're like, well, I don't know, or your blood tests are fine or whatever, you then have to go into another space. And then in that other space, you think that it's going to be the same as in Western medicine, where you go and then they go, here you go. And it's not. That's not how it works. And if somebody is doing that, then it's probably a bit of a problem, because they're just lying to you. So this is the kind of realm that we're in with a lot of people that have chronic illness, that are looking for alternatives. They're expecting a cure or a one pill fix.
Or it's more like symptom relief, I'd say.
Yeah.
Because people don't mind living with the disease as long as they don't live with the symptoms.
Yeah.
And that's like, if you look at like you said about Mast Cell Activation Syndrome and histamine, you had it and you were living through it, and you basically reversed it.
Yeah.
But most people will go to their GP and go, right, I want an antihistamine. An antihistamine blocks a histamine receptor.
Yeah.
All that does is stop the symptoms from happening. But the minute the antihistamine wears off, the symptoms return. And then people go, but that's fine, because at least I don't get the symptoms, I can still function. But all you're doing is you're just literally filling that histamine bucket up.